When someone is unresponsive and not breathing, or only gasping, it is critical to begin CPR right away. CPR consists of 30 chest compressions followed by 2 breaths. In this video, you'll first learn how to give effective chest compressions. Then, you'll learn how to give breaths using 2 different types of breathing barriers. And finally, you'll learn how to put together chest compressions and breaths to give CPR cycles. Compressing the chest and allowing it to return to its normal position moves blood carrying oxygen to the brain and other vital organs. First, ensure that the person is on their back on a firm, flat surface, such as the ground. If they are lying on a bed or couch, carefully move them to the floor. Next, kneel beside them like this with your knees near the person's body and spread about shoulder width apart. Place the heel of one hand in the center of their chest with your other hand on top. Now, interlace your fingers and make sure they are up off the chest. Then, position your body so that your shoulders are directly over your hands. Lock your elbows to keep your arms straight. This technique allows you to use your body weight to help compress the chest. You are now in the correct position to give compressions. When giving compressions, push hard and fast. Compress the chest to a depth of at least 2 inches and a rate of between 100 and 120 compressions per minute, or about 1 every half second. After each compression, let the chest return to its normal position. Watch as I demonstrate just a few chest compressions so you can see what they look like. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Giving breaths supplies oxygen to a person who is not breathing. Studies have shown that breaths in combination with chest compressions increase a person's chance of survival and minimize brain injury. The risk of infection while giving breaths is extremely low, and data shows you will most likely use your training for family or friends. However, a CPR breathing barrier, such as a face shield with a one-way valve or a pocket mask, can further lower your risk of infectious disease. These devices protect you from contacting saliva and other body fluids and from breathing the air that the person exhales. If available, you should use a CPR breathing barrier to give breaths. However, do not delay breaths to find a breathing barrier. While giving breaths improves the person's chance of survival, please remember if you are unwilling to give breaths, you can give compression-only CPR. This still helps the person and will be discussed later in the course. A face shield is a flat piece of thin plastic that is placed over the person's face with the opening over the person's mouth. It has a valve that you give breaths through without making mouth-to-mouth contact. First, place the face shield over the person's face, ensuring the one-way valve is over their mouth. This is the most important step when using a face shield. Then, open the person's airway using the head tilt chin lift technique. Put one hand on the forehead and 2 fingers on the bony part of the chin and tilt the head back to a past neutral position. Next, pinch the nose shut, take a normal breath and make a complete seal over the person's mouth. Then, blow into their mouth for about 1 second and make sure the chest begins to rise, like this. Allow the person's chest to fall and the air to exit while you take another breath. Then, make a seal and give the person a second breath. This is what it looks like put together. A pocket mask is a transparent, flexible device that can be sealed to the face, covering the person's nose and mouth. It has a one-way valve that you give breaths through without making mouth-to-mouth contact or inhaling air exiting from the person's lungs. First, place the mask at the bridge of the nose and then lower it over the person's nose and mouth, making sure it doesn't go past the chin. Now, seal the mask by placing the space of your hand between your thumb and index finger at the top of the mask above the valve, and your remaining fingers on the side of the person's face. Then, place the thumb of your other hand along the base of the mask and place your bent index finger under the person's chin. Lift the person's face into the mask and open the airway to a pass-neutral position by tilting the head back. Gently but firmly hold the pocket mask in place to form and maintain a good seal so air does not leak out of the sides when you give breaths. Now, take a normal breath, make a complete seal over the mask valve with your mouth and give 2 breaths. When you give a breath, maintain an open airway in the pass-neutral position, being careful not to push the head down. Watch as I demonstrate. Remember, each breath should last about 1 second and make the chest begin to rise. Pause between the breaths to allow the person's chest to fall and the air to exit. When giving breaths, the chest should begin to rise. However, you might encounter a situation where the chest does not begin to rise. If the chest does not begin to rise on the first breath, reopen the airway and give a second breath. If the chest does not begin to rise after reopening the airway and giving a second breath, an object might be blocking the airway. That is, the person may be in cardiac arrest due to choking. You will learn about caring for an unresponsive person who is choking in the choking module. Now it is time to put the skills you have just learned, giving chest compressions and giving breaths, together in order to give cycles of CPR for an adult. Each CPR cycle consists of 30 chest compressions followed by 2 breaths. Remember, it is important to begin each CPR cycle with chest compressions. However, if drowning is a suspected cause of cardiac arrest, deliver 2 initial breaths before starting CPR cycles. Also, make sure you smoothly transition between chest compressions and breaths. Interruptions in compressions to give breaths should be as short as possible, taking less than 10 seconds. Okay, now watch as I put chest compressions and breaths together to perform 2 cycles of CPR. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You should continue to give CPR cycles until you notice an obvious sign of life, like breathing, an AED is ready, another trained responder is available to take over compressions, EMS personnel arrive and begin their care of the person, you are alone and too tired to continue, or the scene becomes unsafe.